technical issues, so I had to redo this video. Okay, so as I had introduced myself earlier, my name is Nicholas and I am a pharmacy practitioner. Okay, so in this channel we discuss mostly about blood pressure in seniors, and I always delve into how seniors can manage their blood pressure safely and effectively. Okay, so in this discussion, since it's our first live stream, I will not delve into a lot of details, but I'll just answer some common questions that I've come across while in practice, and some I've researched. Okay, I hope they'll be of great help and to you. Okay, so if you're a senior above 55 years and you're managing high blood pressure, you are in the right place. Welcome. Okay, but it doesn't matter. Even if you're below 55 years and you're managing high blood pressure, you're still welcome. Please subscribe and let me know where you are watching me from, and please also help me know your age group. Okay, it will help me to create more videos for specific age group. Okay, thank you and welcome. So just to delve into our today's topic, let's look at the brief overview of what high blood pressure is. Okay, a brief definition. So high blood pressure means your blood pressure is flowing through your arteries with too much pressure for too long. Okay, remember the keyword for too long. Okay, I'm just giving a layman definition. I don't want to use the medical jargons to define the high blood pressure because some of you may not understand it. Okay, that's why I've just chosen the simplest definition of high blood pressure. So remember what I said, for too long. Okay, meaning consistency. So these are, by this I mean, when you check your high blood pressure, there are those numbers like 140 over 90. Remember when you take you measure your high blood pressure, then you find that then the numbers read 140 over 90, you are hypertensive. Okay, so if you observe those numbers consistently, okay, consistent, not only one measurement but consistently, let's say for a certain period of time, then know that you are hypertensive. But don't declare it, but don't declare it yourself first. Please visit your medical practitioner or a doctor. Okay, any medical practitioner, be it a doctor or a pharmacist, they will be able to advise you further. Okay, so that simple definition, high blood pressure is a condition whereby your blood flows through your arteries at higher pressure than it is normal. Okay, and that those readings must be consistent. Okay, for a certain period of time. I hope I'm clear with that definition. Okay, if you not understood anything, please let me know in the chat box or in the comment section below, and I'll be able to give you a clearer definition. Okay, so if you are watching me live, feel free to type a question in the chat box and I'll be able to answer it directly. Okay, so before we enter into the question that I said that I would ask is, or I mean that before we delve into today's questions, which are the main point of focus tonight, or in some countries morning and some during the day. Okay, so before we enter into this, our main point of focus tonight, more about high blood pressure. Okay, so blood pressure is when you do a checkup of your high blood pressure, normally you'll see two numbers on the blood pressure monitor. Okay, the screen of the blood pressure monitor, the top number and the bottom number. So the top number medically is known as systolic number, and the bottom number is diastolic number. Okay, and in one of my videos in this channel, I've delved deeper into what those numbers mean. If you have time or take time, you can go and check those videos. I think they can be of great help and to you. Okay, so those are the main numbers that determine the level of your high blood pressure. Okay, so generally there are levels of high blood pressure. There is normal level, which ranges from, no, not which ranges, but it's the normal level is 120/80. Okay, then we have the elevated level. Elevated level is anything above 120. Okay, 120 to anything above one. Let's just say the systolic, anything above 120 is elevated. Okay, so if your systolic number is, let's say, 125, 129, it's elevated. Okay, but it's not hypertensive, it's just an elevation. Okay, please understand me. So if your doctor finds out that you have such a level of high blood pressure consistently, it's not, it doesn't, I don't mean that when you just take maybe a one-off checkup, then you find your level is above, your systolic blood pressure is above 120. I don't mean that you have an elevated high blood pressure. It should be consistent. Okay, for some days. Okay, it must be consistent. The keyword there is consistent. Please take note and don't take me wrong. Okay, so elevated, as I said, is anything when your systolic is above 120 onwards. Okay, 120 to 120, anything is above 120 going up to 129 or 130. Okay, that's an elevation. Okay, systolic, remember I'm talking about systolic, but the diastolic remains the same, 80. Even if the diastolic remains the same, 80, but the systolic is above 120 and above, it's an elevation. Okay, I hope I'm clear. I've repeated it severally. So let's go to the hypertensive now. When your doctor tells you that you are hypertensive, okay, you are a patient. So this is where your systolic number is 140 or above 140, okay, and your diastolic number is 90 or above 90. Okay, that's now that your doctor will declare that you are hypertensive and you have to manage it. Okay, there's no shortcut for that. I hope I'm understood there clearly. Okay, so even as we move forward, if you are watching me, let me know where you're watching me from. I'll appreciate it. Okay, this channel is for all of us, and I'll be happy if I'll know the countries or the locations that you are watching me from. Okay, just an important note I want to tell you about. In 2017, the American College of Cardiology and the American Heart Association, they lowered the threshold by which a patient is supposed to be declared hypertensive. Okay, remember I had mentioned your doctor will declare that you are hypertensive when your systolic is 140 or above 140 and your diastolic is 90 or above 90. But in 2017, the American College of Cardiology and the American Heart Association lowered that threshold. Reason being, they just want to curb some catastrophic effect that come up with the earlier numbers. Okay, so they lowered it to the, so at this time that threshold means that if you check your blood pressure now and you find that your systolic is 130, then you are hypertensive. Okay, yeah, because they lowered it to systolic of 130 or above 130, then the diastolic is still 80 or anything above 80, then you will be declared hypertensive. Okay, I hope I'm clear. Those are the new guidelines. Okay, the recent guidelines, but your doctor may advise you otherwise. Okay, depending on the history or your health profile. Okay, yeah. So but for older adults, targets may vary depending on the following. Okay, for older adults, sometimes the doctor may, that's just the way I had said that your doctor may advise you otherwise. So, but in older adults, your doctor may 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 advise you depending on your age, history of strokes or heart disease, kidney problems. Okay, maybe if you have any other comorbidity, okay, comorbidity like diabetes, and maybe when you have the risk of falls, okay, your doctor may advise you others based on those conditions. Okay, so that's the reason as to why one number one let's say like the doctors can't use only one one level of blood pressure measurements to diagnose all patients. Okay, there are times they will observe the elements that I've just mentioned. Okay, so let's look at why high blood pressure is dangerous. Okay, the reason as to why high blood pressure is dangerous is because it's silent. Okay, it does things silently. You may not realize. Okay, if you are not, if you are that kind of person who is not concerned about maybe just having a blood pressure checkup, mostly if there is a history of blood pressure in your family, okay, at times you may not know that that thing is in you. That thing, I mean the high blood pressure condition, you may not realize that it is in you. And the worst thing is that the damages it causes them silently, without any warning, without any notice. Okay, so you may not realize anything. Okay, you may not know anything. Okay, so that's why it is so essential for you to keep checking your high blood pressure, mostly if there is any history of this condition in the family tree. Okay, but even if it is not there, for any senior or any other person, even the younger ones, I can advise just keep checking your high blood pressure levels. Okay, mostly if you are above 50 or 55 and above. Okay, so that's why it is dangerous. Okay, yeah. So some of the risks that comes with the high blood pressure are stroke, heart attack, heart failure, and kidney damage. Okay, that's why it's so essential. And these things, mark you, they can happen without you realizing it. The moment you come to realize that you have a kidney failure, it is finished. Just I don't want even to think of such a situation. Okay, but please keep monitoring your high blood pressure, and you'll thank me later. Okay, so if you are watching me live, feel free to type your question in the chat box. I'll appreciate so much as we keep going. So let us delve into our today's discussion. Okay, let's just delve into the discussion. The main points, the main topic of today, the question that I had said that I'll address. Okay, so the first question is, what is considered high blood pressure for seniors? Okay, I have answered that question earlier. If you followed me clearly and keenly, I think I've answered it. Okay, and I have also addressed the new guidelines from the American College of Cardiology and the American Heart Association. Okay, just to reiterate, high blood pressure, the earlier guidelines, it was that when your systolic readings are 140 or above, then you are hypertensive. And when your diastolic is 90 or above, then you are declared hypertensive. Okay, but the new guidelines that were reviewed in 2017 by the said organization, I mean the American Heart Association and the American College of Cardiology, the new guideline is that when your systolic readings are 130 and your diastolic is above 80, then you'll be declared hypertensive. Okay, but as I had said earlier, these ones will majorly depend on also some of the element I mentioned earlier, the age, risk to some diseases, okay, and other things, okay. I hope that is clear. Let me know in the comments if that sounds clear, okay. I will appreciate. So the second question is low blood pressure dangerous for seniors? Absolutely. Low blood pressure is very dangerous. Just the way high blood pressure is dangerous, so is low blood pressure, okay? Okay, I just want you to think of this scenario that your heart is pumping blood, but that blood is not reaching your vital organs. Just imagine what the consequences are. Very fatal, okay? So those are some of the effects of low blood pressure. Is where, let's say, your heart is pumping blood, but your vessels are far much or dilated in a way that is so extreme that the pressure in those vessels is so low, okay? That makes the vital organs not receive sufficient blood supply, okay? So in that case, that shows how low blood pressure can also be catastrophic, okay? So when you have this when you experience that situation of or that when you reach a point where you have low blood pressure, you may begin having symptoms such as confusion, dizziness, okay, because your brain is demanding for oxygen, but it doesn't receive enough blood, okay, and you know the supply of blood to your brain and other vital organs, blood carries oxygen, okay, so it's essential for your brain to have enough blood. So when you begin experiencing some sort of dizziness, confusion, lightheadedness, and many other things, please check in with your doctor, consult your doctor, okay? Because it can also lead to something that I don't want to scare you with, okay? Yeah, so low blood pressure is just as dangerous as high blood pressure. Please note that. And mostly when you are using blood pressure medications, okay? Yeah, because at some point your doctor can prescribe very strong medications that can really reduce your fresh your doctor can prescribe very strong medications that can reduce your blood pressure to a level that is not required, okay? That's why it's always good to check in with your doctor when you experience such a condition, okay? Mostly when you are on blood pressure medications. So low blood pressure, again, is just as dangerous as high blood pressure, okay? Yeah. So the next question that you want to tackle today, and remember that most of the low blood pressure cases ranges from maybe the systolic of 90 and the diastolic of 60, okay? That's when you'll be declared you have low blood pressure, and anything below, okay? And remember, if it goes further than that, that is something else. So another question that I want to talk about, why do I feel that this is the common question that I get from many seniors, okay? Why do I feel dizzy after taking my blood pressure medications, okay? Just to be straightforward, dizziness comes from, let's say, the effects of some medication, the side effects of some medications, okay? So you have to be cautious of that, okay? Because some medication, just as I had mentioned earlier, can decrease your blood pressure to low levels that can have catastrophic effect on your body, okay? So please be cognizant of that, and I hope that helps. So when you feel dizzy, it may be that you are taking strong medications that lowers your blood pressure so low, and also it may be that just the way I said, your blood pressure has dropped so fast, okay, And also another point, it may be that maybe you are not well hydrated, you are not taking a lot of water when you are on these blood pressure medications. And lastly, taking blood pressure medication without eating on empty stomach, okay? Please have a meal before you use these medications, okay? And there are some meals that you are supposed to avoid while you are using certain blood pressure medication. Just note that, okay? I think I've created a video on that note, okay? If you find time, you can just go through my channel, you'll find such a video where there's some foods that are reacting with blood pressure medications, okay? Yeah, but all in all, you're supposed to have a meal before you take any blood pressure medication, unless your doctor advises otherwise, okay? So that's why you may feel some sort of dizziness when you are on blood pressure medication, okay? I hope I'm clear there. Please keep commenting, I'll appreciate. Type yes if you've ever experienced some sort of dizziness while you are taking blood pressure medication. Just type yes, okay, in the chat box below, and I'll appreciate it. So the other question is that, should seniors take blood pressure medications every day? Well, this question comes from a point of lack of information, okay? Yeah. Please, if you are managing high blood pressure, I want you to know that high blood pressure is not treatable, okay? It's just controlled, okay? But to also give you hope, there are some situations, or what I can say, there are some circumstances where people maybe make some adjustments in their life, their lifestyle changes that can really control your pressure to the point where your doctor can recommend that you leave the medication or reduce some medications, okay? Or excuse you from some medications, okay? But blood pressure in real sense, it is not treatable. It is not treatable, okay? So you have, when your doctor prescribes some medication, or when your doctor prescribes medications, you're supposed to take them daily, okay? Unless you are advised. So never stop taking blood pressure medication suddenly on your own. They can have that decision, it can cost your life, okay? Please note that. Take them daily. Blood pressure is not treatable, but it's just controlled, and these medications, they help you control it, okay? I hope that is well understood. So another question that is frequently asked, what time of the day is best to take blood pressure medications, okay? What time of the day is best to take blood pressure medications? So this question, it depends. There are those medications that you are supposed to take in the morning. There are others that you are supposed to take in the afternoon. There are others that you are supposed to take at night, okay? Depending on the side effects of these medications, okay? Let's say like a medication like hydrochlorothiazide. Those who know, or those who are using it, hydrochlorothiazide is a medication that is used to manage some, let's say it's used to manage high blood pressure or is a condition of the heart, okay? But when patient who takes hydrochlorothiazide, they really, okay, they visit bedrooms frequently, okay? Why? Hydrochlorothiazide is a diuretic medication. Diuresis, meaning it makes you lose a lot of water from your body, okay? That's why sometimes you have to get hydrated, because some of these medications, they make you lose a lot of water, okay? They dehydrate you, so you end up going to toilet, the bedroom frequently. So those medications are taken in the morning, because if we take them at night, then they'll disturb your sleep, okay? And sleep is one of the essential component of managing your high blood pressure. You're supposed to get enough sleep for you to manage your blood pressure well. So medication like hydrochlorothiazide are supposed to be taken in the morning for the reason I've just explained, okay? Other medication like amlodipine, losartan, they're supposed to be taken, let's say, some in the morning, some at night. But like amlodipine, it's the main side effect of amlodipine I can remember is dizziness, okay, and lightheadedness. So such medication are supposed to be taken at night, okay? So just remember a scenario where, maybe think of a scenario where you are driving, but you've taken a medication like amlodipine, you begin feeling dizzy while you are driving, or you are just doing your normal chores. It can really affect you. That's why you are supposed to take it when you are going to bed, for minimum distractions, okay? Yeah, that's how I can answer that question. There are those ones there are those medications that are taken in the morning. There are those that are taken when at night time, okay? Yeah. So another question, can lifestyle changes really help seniors with blood pressure? Can lifestyle changes help seniors with high blood pressure? Absolutely. I've already discussed and talked about that briefly. Let's say let's say that you are overweight. If you work on your weight, there are situations if you are overweight, then you work on your weight, you reduce your weight. At some point, your pressure can get controlled. Then your doctor advise you to maybe leave medication or reduce the medications you are using, okay? Let's say also maybe you are taking alcohol, you are smoking, okay? Then you just decide to abandon those habits. Your pressure can be controlled and also end up reducing or leaving medications entirely, okay? Yeah. So lifestyle changes are so important in blood pressure management, okay? Some of these lifestyle adjustments include maybe reducing the amount of salt you take or the quantity, just having some sort of exercises. Like seniors, just a gentle walk is enough, okay? Don't stress yourself with running, mostly if you are a senior, okay? Gentle walks is enough. Drinking enough water, that is hydration, okay? That's also enough. And the most important thing is managing stress, okay? Stress nowadays is a big issue in blood pressure management, okay? I don't understand, is it because there are so many problems on this earth? But anyway, manage your stress effectively, okay? Observe that, okay? And also, okay, and also I had mentioned about sleep, okay? Ensure you have enough sleep, okay, for you to manage your blood pressure effectively. So the next question is, when should a senior go to hospital for high blood pressure? Okay. If you are keen, while I was discussing this, I think that question is well answered and well dealt with. Okay. When should a senior go to the hospital for blood pressure? So for this question, I just say that seek urgent care of blood pressure if your blood pressure is very high or very low. Okay. Yeah, and I've already mentioned when to determine when to determine if your blood pressure is low or high, okay? So if you experience symptoms like chest pain, severe headache, confusion, shortness of breath, or fainting, please consult your doctor, okay? Because some of these symptoms can indicate maybe you're having a heart attack, okay? Maybe your blood pressure is so low, like severe headache is mostly majorly a symptom of high blood pressure, and chest pain is a symptom of high blood pressure. Maybe you are having some sort of heart attack. Confusion, hypotension. By saying hypotension is a medical term for low blood pressure, okay? Yeah. So when you're having confusion, meaning your body or your brain is not getting enough supply of blood, meaning low oxygen, okay? Shortness of breath, the same thing. Fainting, also the same thing. Okay. Please, I hope you are still commenting in the comment section below, and I'll appreciate it. Okay. Okay, that marks the end of our the question that I wanted to deal with. If you have any other question that you feel that I have not answered in this session, please let me know in the comment section or in the chat box, and I'll be able to address it even after this live. Okay, I'll just come back to you. So I want to thank you for joining me today, and I appreciate you so much. So if you have any other question, please let me know in the chat box or in the comment section below. Okay, please remember, managing blood pressure is not just about numbers, okay, but about safety, quality, and also, okay, it's about safety, quality of life, and also preventing falls and other complications. Okay, please take note of that. Don't stress yourself so much. Just ensure that you have blood pressure monitor in your house to keep monitoring your blood pressure. So if you found this video helpful, consider subscribing, liking this video, and please share it with someone you know that this information may be really help them. Okay, please do so. Don't be conservative with the information and I'll appreciate it. Okay, so let me know. Okay, another request that I have before I conclude, this is the last one. Okay, this is the last request. Please just let me know the days and the exact time you would want that I keep bringing you these live streams. I mean the day and the exact time. Okay, and I'll appreciate it, and I will deliver. I promise I'll deliver. Okay, so thank you very much for watching. Stay safe and stay blessed. Bye.